The spine is divided into 5 curved sections: cervical, thoracic, lumbar, sacral, and coccyx. Each section is composed of bones called vertebrae, which are separated by intervertebral discs. Muscles are attached to the spine to provide strength. Ligaments are on all sides to provide additional support. The lumbar spine is the section most prone to injury from lifting because the vertebrae are freestanding, not anchored to the ribs or fused like other sections of the spine.
The common mechanisms that we see a back injury occur are through the forces that affect the spine, specifically the lumbar spine. So compression is one of the most common forces, and that's just the gravitational pull that is always pulling down on a vertebrae. However, we enhance the forces when we're lifting up a patient. Even when we're lifting correctly, we're transmitting all of that force down our spine, and our lumbar spine vertebrae and discs are being exposed to all of that pressure.
Shear forces are those that are perpendicular to the spine's axis.
So shear forces is every time that you lean over to your side to pick up a bag or a piece of equipment and you carry it with your shoulders slightly out of balance to that side. That constant shear force over time will have an effect on your discs in between your vertebrae.
Torque is the rotational force at work when you hold an object further away from your body during a lift or twist.
The third, and potentially the most acutely dangerous mechanism, is the torque forces. The torque forces are when you lean over in an awkward position to pick up a patient who isn't very accessible, and your lumbar spine sustains an angular force that is not designed to sustain, and that is what can lead to an acute sudden injury.
The most common types of injury related to the lumbar spine are muscle spasm, spinal disc herniation, and compression fracture. Muscle spasm is the involuntary contraction of a muscle or group of muscles marked by sudden pain to the spasm area.
The next most common is disc herniation, which we commonly refer to as a slip disc. And that's when the intervertebral discs in between your vertebrae slip back from overuse and can actually impinge your spinal cord, causing sharp pains down your legs.
A compression fracture occurs when vertebrae in the back collapse, generally occurring gradually over time.
Over the years of EMS work and lifting, your vertebrae are under a lot of stress and will actually experience small compression fractures.
It is essential that EMS providers maintain physical fitness in order to reduce the risk of sustaining severe or repetitive back injury.